Hey guys, Dr. Mark Dailey here with a functional medicine case study. I've put this together kind of quickly, so if there are some spelling errors or some typos, please forgive me. I wanted to get the information out to you. So this is obviously what we would call a patient case study. This is a real person. She is a 49-year-old female. 5 foot 5.5 inches, 99 pounds, which is underweight, suffering from chronic fatigue, overall physical weakness, foggy, slow thinking, and really gastrointestinal issues. She had excessive bowel movements. I mean, maybe 5 to 10 a day, frequent urination, excessive thirst, dizziness when standing up quickly. She had other considerations, which would be extended antibiotic use as a child, mold exposure. She had had typhoid and malaria. She was exposed to burning plastic and lived in a foreign country. We did some advanced laboratory testing. We did a comprehensive stool analysis. That's really important to tell us what's living inside of their gastrointestinal system, which you'll see in a moment. Environmental toxins, we checked for those. We checked for glyphosate toxicity, food sensitivities. We did an organic acid test and a yeast or candida test. I'm pulling out just the highlights from each of these tests, the things that were the biggest issue. And in this comprehensive stool analysis, they break down the literal families that are living in your gut. So here are good bacteria. These are beneficial. They're good for you. They help you maintain good health. Those actually looked good. These are commensal, which means they're not good or bad unless they're out of proportion. But then here, this is a dysbiotic, pathogenic bacteria. So we found a bad guy there. Oftentimes, these bad guys relate to the symptoms. In this case, potentially diarrhea. Let me go back down here. Also, we noticed that she had candida in this stool study. Also, in the same stool study, she had a protozoa. And this one, you'll see in just a moment, does cause diarrhea. So nausea, diarrhea, abdominal pain, anal itching, weight loss, which was an issue, excessive gas have been reported in some persons with this infection. Not a small thing. Here, we also found that she had Candida albicans, which is a fungal overgrowth. So she's got a fungus in her gut that's way overgrown. Why is that a problem? It's a problem because their byproducts are toxic. So their byproducts are toxic and they create a negative environment in the gut. They make less room for the good bacteria that help you live a healthy, full life. They overgrow. And then here, this was a urine test that we did, and it showed high levels of glyphosate. And glyphosate is the world's most widely produced herbicide, broad spectrum herbicide that is used in more than 700 different products for agriculture and forestry. It is a big deal and a big problem. Recent studies have discovered glyphosate exposure to be a cause of many chronic health problems. It can enter the body by direct absorption through the skin, by eating foods treated with glyphosate, and most of them are, or by drinking water contaminated with glyphosate. But basically they are looking at disorders that it may cause, like autism, metabolic disorders, diabetes, depression, cardiovascular disease, and autoimmune diseases. And autoimmune diseases include things like Hashimoto's thyroiditis, rheumatoid arthritis, MS. There is a whole list of autoimmune diseases that we see frequently in those that are suffering with chronic conditions. Then here, this is a food sensitivity test. And again, this tests over 200 foods. I'm simply hitting the highlights. So here we have dairy. When you see these black lines extended, that means that there is a sensitivity. It breaks it down to dairy, vegetables, meats, just a number of different food things. Now, over here, these are all in the green. So for most people, that's not a big deal. There was one other thing that just was off the charts, and that's sesame seed. I know that's hard to believe, but it's sesame seed for this patient. Not necessarily for you, but we're finding food sensitivities. Now, again, this is an environmental toxin or environmental, this was an environmental toxicity test. And in this one, what we're looking for is the long black lines. Guys, no matter who it is, you or me, even if you don't feel bad, you are still toxic. You're going to have low levels because we live in an absolutely toxic environment. But look at this. This is off the chart. So where does this come from? Gasoline additive used to improve octane ratings. Exposure to these compounds is most likely due to groundwater contamination, inhalation, or skin exposure to gasoline or its vapors and exhaust fumes. Again, I'm just hitting the highlights. Here is another long black line. This is an insecticide. So the number one thing we have to do for these folks, besides help them to detoxify, is to make sure that they're not continually exposed to these horrendous toxins. Let's see where we're, okay, here, this is an organic acid test. This is done with urine too. Now this section is looking at intestinal microbial overgrowth. This is a really cool test too, because it looks at your gut, it looks at your neurotransmitters, it looks at your vitamin and nutritional deficiencies, your digestion and absorption. It's really a good test. Again, I'm just highlighting areas where there were problems with this particular patient. And again, yeast and fungal markers. So we're high here. So we know that is an issue. We're verifying that in the stool. We're verifying that in the blood. And then now we're seeing it in the urine. And then here, this is an indicator of detoxification issues. Now think about that. Is she toxic and overloaded in some areas because she's got a problem personally detoxifying? That is not impossible. So what we do in those cases is we have to help the detoxification pathways and make it easier for her to detoxify. And we have some really unique strategies there. So this poor woman, like many of you that will watch this video, she's like an 8-cylinder car running on 3 cylinders. I mean, she might get where she's going, but it is not pretty, and it takes every ounce of energy she has. So what did we see? Yeast overgrowth, food sensitivities, glyphosate toxicity, several other environmental toxins from gasoline or petro, and insecticides. We saw detoxification abnormalities, pathogenic bacteria, parasites, and we can assume from this, because so much is going on in her gut, that the lining of her gut has been destroyed, and that created leaky gut syndrome. So now, equipped with this information, we're able to create a targeted, personal treatment plan. This is designed to starve yeast overgrowth and improve the environment of your gut. Supplements, we introduce supplements that are proven to kill parasites and pathogenic bacteria, and supplements and lifestyle changes designed to help improve detoxification. Once the bad guys are removed, we go back in and heal and seal the gut lining. Then we start to reintroduce foods that are nutritionally dense back into her diet to see how she responds. So, guys, this advanced testing is absolutely a game changer. I've been doing many of these for over 15 years. They've given us insight into chronically ill patients that they are not getting anywhere else. Now, you're probably seeing this video on YouTube. If you think this is interesting, please like it and share it. That way it'll be exposed to more people suffering from chronic issues. If you would like for my help, I've got a website here. You're welcome to go there and browse. You can call my clinic directly. I do offer a free telephone consultation. So if you're really sick and tired of being sick and tired, I offer you the opportunity to talk with me one-on-one to see if perhaps I might be able to help you. Guys, thanks so much for your time and attention. God bless you and have a great day.